Welcome, and thank you for joining the Workers' Compensation Management Bureau's Work Comp Part 2, the Stay at Work, Return to Work webinar. My name is Tani Jo Aguirre, and I am the Workers' Compensation and Safety Specialist with the Work Comp Management Bureau under the Healthcare and Benefits Division within the Department of Administration. Today's webinar is part 2 of a multiple-part series. This webinar will cover what a Stay at Work, Return to Work program is, the roles and responsibilities within the Return to Work process, and how we at the Workers' Compensation Management Bureau can assist you in your Return to Work efforts. Before we jump into the Stay at Work, Return to Work program, let's do a quick recap of what we covered in Part 1, Workers' Compensation, the basics. In Part 1, we discussed the injury reporting process. Reviewing that process from the beginning, when an employee experiences a work-related injury or illness, the employee has 30 days to notify their employer of an injury and 1 year to file a claim with Montana State Fund. Please note, it is best practice to notify the employer immediately or at least within 24 hours of the injury occurring. If the employee needs to seek immediate medical treatment, the employee does not need to wait for their first report of injury form, also known as a FROI, to be filed, or for their workers' compensation claim number prior to seeking immediate medical treatment. Do not delay. The first report of injury and work comp number can be completed and provided to the medical provider after initial treatment is sought for immediate medical needs. If the injured employee does not need immediate medical treatment, the employee should notify their supervisor and complete a first report of injury form. The supervisor should assist the employee in completing this form and submitting it to the agency's appointed workers' compensation contact for submittal to Montana State Fund. The employee can seek medical treatment wherever they choose. The only place they cannot go for a work-related injury is the state-run facilities known as Care Here. They will not treat work-related injuries. Once the employer is notified of an injury, they have 6 days to file the claim with Montana State Fund. Again, best practice is employees should notify supervisors immediately of an injury, complete the first report of injury, and notify their employer within 24 hours of the injury occurring. The employer should submit that first report of injury form to Montana State Fund within 24 hours. This is where we ended on Part 1. Today, we will move into the steps we take after the employee seeks medical treatment. Before we get into discussing the medical status form and transitional duty, let's discuss what a Stay at Work, Return to Work program is. A Stay at Work, Return to Work program outlines the general procedures for handling work-related injuries or illnesses. It represents an employer's commitment to the health, safety, and recovery of employees following a work-related injury. Having a return to work program can help you save money and spend less effort throughout the workers' compensation process. A return to work program allows your employees to return to a transitional duty job while they recover from an injury that occurred at work. The goal is to enable injured employees to be productive during their recuperation and to maintain a connection to the workplace. A Stay at Work, Return to Work program is part of a business strategy to retain valued employees and to enhance the productivity of the workforce. The primary focus of this program is to keep an injured employee working as much as possible instead of taking leave, in order to reduce the cost of absenteeism and lost productivity. As we all know, employees are a business's most valuable resource, and Any injury or illness can interrupt the work activities. Small agencies or work units are especially hard hit when an employee's injury keeps them away from work. The goal of any good return to work program is the safe return of employees to transitional or regular employment. Medical research has shown that people recover more quickly if they remain active and return to the normal routine as soon as possible. Ultimately, this will assist in getting an employee back to work in a more timely manner by creating transitional duties that are meaningful and productive to the injured employee and agency. This will assist in the employee's recovery process and get the injured worker back to the time of injury duties. We simply do not treat an injured worker as a statistics. We must remember the workers' compensation numbers you review monthly represent humans that have been affected by a workplace injury. An effective return to work program will assist in the recovery process by getting the employee back to work in a meaningful and productive, safe work environment. This also increases safety awareness in the entire work team. This can be a simple safety meeting to discuss what happened to the injured employee and what we as an agency are doing about it as our continual improvement in our safety efforts. This will improve morale by supporting employees with a caring attitude. The added benefit is a reduction in insurance costs, therefore providing more funding to the agency. Without a return to work program, employees do not know where to turn for help and over time are less likely to return to work. What are the benefits of having a stay-at-work return to work program? Early intervention through participation in the stay-at-work return to work program can be key in preventing a long-term loss. In many cases, an employee has not been completely restricted from working, but remains on leave for extended periods of time unnecessarily. Stay-at-work, return-to-work programs reduce the need for an employee to remain on leave during what is a relatively short window of time in which an injury or illness can transition into a long-term issue. Research suggests that the likelihood of an injured worker returning to work drops below 50% by the 12th week of leave. And when employees remain on leave when they could be working, the negative impact can extend from the individual to the employer and beyond. Having an active program benefits the employer by retaining experienced workers. Injured workers who remain at home for an extended period may become discouraged and leave the position. You can retain valued employees by returning them to the workplace as soon as they are medically able. Better employee relations. When you create a successful return to work program, you send a message that you care about your workers and their welfare. Better productivity. Even if they can't perform at full capacity, injured employees will be more productive if they are at work than they would be had they been at home. Reduce turnover. By getting injured employees back to work quickly, you can avoid the cost of hiring and training temporary workers or permanent replacements, and lowering workers' compensation costs. Injured employees who return to work part-time will collect fewer disability benefits than they would have if they remained at home, which directly impacts your agency's premium. A return to work program also benefits the employee by continued social connection. Injured employees who return to the workplace promptly can retain their social connections. They also regain a sense of purpose from a daily work routine. Financial security. For a temporary total disability, a typical worker receives a weekly benefit of only 66% of their average weekly wage. Most workers will earn more money by returning to work, as well as when an employee is off of work and receiving work comp payments, they are no longer accruing leave, such as vacation or sick, contributing to their retirement, or time served. Skill retention. A return to work program can help injured workers retain valuable skills. The old saying goes, if you don't use it, you lose it. Better morale. Your workers may feel more secure about their jobs if they know you'll facilitate their return to the workplace after an injury. In order for a return to work program to be effective, both the employer and employees need to play an active role in supporting the program. We all rely on each other to get the job done every day. When a worker suffers from a work-related injury or occupational disease and is unable to work, we suffer the loss of a friend, lost work production, heavier workloads on fellow employees, and the higher cost of insurance that affects operations. Employees do not need to be lost in the system. A return to work program helps keep time away from work to a minimum. Now that we understand what a stay-at-work return to work program is and its benefits, let's discuss what we need in order to return an employee back to work after they experience a work-related injury. When an employee seeks medical treatment, the injured employee's treating physician will provide a medical status form to them at the end of their visit. The medical status form indicates the degree of work restrictions the injured employee has, if any. This form is to be provided to the supervisor and agency's work comp rep following each appointment. The medical status form is a document that serves as a tool for the healthcare provider to indicate the appropriate level of functional ability for an injured worker. The functional ability of the injured worker typically progresses over time as the individual heals. The medical status form, once completed by the healthcare provider, serves as a roadmap for the agency in developing transitional duty. Using this form. Most medical providers already have this form on file at their office. However, it is never a bad idea for the supervisor to send the medical status form with the injured worker to the initial appointment with their healthcare provider. You can get a blank copy of this form at the Workers' Compensation Management Bureau's website, which is workerscomp.mt.gov. It will be under the Return to Work Program tab in the Tools and Forms section. The injured worker must return the completed medical status form to their supervisor and work comp rep prior to returning to work. Supervisors must make sure the injured worker understands their responsibility is to return the completed medical status form to their supervisor and work comp rep immediately after the initial appointment with the healthcare provider and all future appointments. It is the responsibility of the supervisor and work comp rep to ensure the medical status form is completed properly. The medical status form will be used by the employee's supervisor and agency work comp rep to identify transitional duty. The employee supervisor and work comp rep will work with the employee on transitional job duties that align with the restrictions documented on the form until the injured employee is back to work full duty without work restrictions. The supervisor and work comp rep must monitor and evaluate the medical status forms over time for any authorized changes as the injured worker heals. Make updates to transitional duty functions as the healthcare provider recommends. When we are reviewing the medical status form and looking at assigning work within restrictions, we must understand the terms. The first term we should discuss is transitional duty. Transitional duty is defined as modified, temporary work assigned by an agency to an injured worker that allows the injured worker to return to the workplace prior to the time when they are able to perform all normal job functions. Transitional duty fosters faster, more complete recovery. Finding transitional duty for each worker is essential to the recovery of the employee and morale of the workforce. Transitional duty is a temporary assignment with the understanding that the duties will increase as medical restrictions are adjusted in transitioning towards full release. Transitional duty does not always mean time of injury job duties. When an employee is injured on the job, we must be committed to providing return to work opportunities as soon as the worker is medically able. Transitional duty is a requirement of this program. When discussing workers' compensation, we must always keep in mind that the main component is communication. Communication between all parties is critical. During the period in which an employee is working transitional duty, periodic checks should be made with the injured worker to determine if there is any changes in the employee's restrictions that would allow additional duties to be added to the employee's tasks. These reviews should occur following every doctor's appointment, as the employee is required to provide a medical status form after each visit, and at minimum every 30 days. Ideally, available transitional duties should already be defined prior to an injury occurring. The Workers' Compensation Management Bureau strongly recommends that each agency create a transitional duty job bank which outlines tasks that can be completed for individuals in transitional duties. The Workers' Compensation Management Bureau is available to assist in identifying transitional duties for injured employees and providing guidance. Remember to always document all conversations and efforts made with each injured worker. We all play an important role in the stay-at-work, return-to-work process. It is a partnership, a collective effort to give the best service and care to our employees during a time of injury and recovery. We will now review the roles and responsibilities of the injured employee, supervisors and managers, agencies' workers' compensation, safety, human resource representatives, and our insurers, currently Montana State Fund. Employees must complete the following steps. Participate in new employee orientation at time of hire. Participate in on-the-job task-specific safety training. Follow all agencies' policies regarding safety, workers' compensation, and stay-at-work return to work. Report incidents and accidents to a supervisor within 24 hours. If a workers' compensation claim is filed, employee must work closely with insurer, supervisor, and agency workers' compensation rep. Work closely with treating physician to ensure that medical status forms are accurately completed, and submit a completed medical status form to supervisors and workers' compensation rep for the evaluation of the stay-at-work return to work. Supervisors and managers' responsibilities in the return to work process. Predetermine potential transitional duties. As we discussed, create a transitional job duty library. Report accidents and injuries to your workers' compensation rep within 24 hours. Conduct an accident investigation. Maintain communication with employees, and work to install a positive culture. Management commitment is a critical element of an effective return to work program. Management must provide adequate authority and resources to employees in supporting their effort to meet assigned responsibilities. Management must help employees at all levels understand their responsibilities and must hold employees accountable for compliance with the return to work program. Managers and supervisors must set a good example of return to work by following return to work policies consistently with all employees within operations. The Safety and Human Resources Rep responsibilities in the return to work process. Develop and implement an effective return to work program. Promote consistency in the return to work implementation. Work with supervisors and managers and the Workers' Compensation Management Bureau. Make sure all employees receive new employee safety orientation. Ensure documented restrictions of injured workers are met. Manage workers' compensation claims, and document all conversations and meetings held with injured employees. Montana State Fund's role in the return to work process. Overall, our insurer Montana State Fund plays a huge role in the workers' compensation claims management. They are the claims manager. And in the return to work process, it is equally important. The Montana State Fund and Workers' Compensation Management Bureau are partners in all the workers' compensation matters, including the return to work process. We work together to ensure the injured worker is provided the best medical treatment, timely wage loss compensation during the healing recovery, and ultimately the best care possible for the insurer and employer. All medical treatment and handling of the information is handled and managed by our insurer, Montana State Fund. Working together, we are able to monitor, track, and assist the injured employee's recovery status after injury to identify the opportunity for transitional, modified, or release to time of injury job roles. If you have any questions regarding the claims management process, these questions should be answered by Montana State Fund. How the Workers' Compensation Management Bureau can help. The Workers' Compensation Management Bureau was established by statute in 2007 to address significant rising costs in Montana's workers' compensation premiums. State agencies encounter a significant number of on-the-job injuries leading to higher costs for employers. The Workers' Compensation Management Bureau is tasked with helping all state agencies manage their workers' compensation insurance and their safety and return to work programs. The Workers' Compensation Management Bureau serves as the central resource for agencies in the managing workers' compensation insurance and works to enhance existing safety, loss prevention, risk management, and return to work activities. The Workers' Compensation Management Bureau works closely with state agencies and Montana State Fund to help prevent injuries at work, assist in management of the claims, and the return to work process. Both work-related injuries and occupational diseases can have a long-term impact on agencies' cost and employees' quality of life. Injuries not addressed quickly may lead to long-term disability. Being out of work can cause significant financial hardship. Preventing injuries is always the best practice for both the employees and employers. The Workers' Compensation Management Bureau is responsible for coordinating quarterly claim review meetings with insurer, identifying high-impact claims and actions to mitigate the impact, formulate claims reports to highlight potential high claims impact, escalate claims to leadership to ensure prompt action, facilitate return to work accommodations from one agency to another, and present employer return to work training to agencies and employees. This concludes Part 2, the Stay at Work, Return to Work program. If you have any questions, here is my contact information. Please do not hesitate to reach out to us at the Work Comp Management Bureau. Thank you for attending.